Budget cuts to Idaho's mental health peer support systems have gone into effect. Now, the impact of those cuts on the severely mentally ill will start becoming evident over the next few weeks.
These are the individuals who there's no way to stabilize them unless they have absolute constant care.
Thursday's mental health crisis meeting in Pocatello focused on how to provide a temporary solution before larger issues could possibly be addressed in the state's legislative session come January. District 28 Representatives Rick Cheatham and Dan Garner were in attendance at the meeting.
My goal today was to create a system that would help that community that's in crisis without further burdening all of the other parts of the system. Something that will address the root cause of the problem, which is the lack of or the loss of this peer support network.
Law enforcement, healthcare providers, and local government officials were on hand to share their concerns and ideas when it came to addressing the issue.
What our solution that we talked about today was to utilize the 988 system to help provide some of that, for lack of a better term, Band-Aid services for peer support to help people get through crises and stuff rather than send them to the jail or rather than send them to the ER.
A representative from Magellan Health Services provided statistics of the effectiveness of Idaho's crisis and suicide hotline. The 988 hotline has a three-pronged approach, providing those in need with someone to talk to, someone to respond, and a place to go. Those in crisis are able to call the hotline, which has lines for law enforcement and emergency medical services, a Spanish-speaking line, and a special line for veterans. Mobile response teams can be dispatched to those in crisis, where they can coordinate care or refer them to a higher level of care. Data shows no incident in the last 4 quarters where a mobile response team was unable to respond. Those in crisis have a place to go in the form of crisis centers. There are 7 adult centers and 4 youth centers in the region.
The 988 system is in place. People should learn to call the 988 when they're having a mental health crisis. So now we need to get the awareness out that 988 is the number to call when you know someone or if you are in crisis. That's the place to go for help.
Until a possible permanent solution can be reached in January's legislative session, the next step for stakeholders is raising awareness of Idaho's crisis system of care. Anyone suffering a mental health or substance use crisis can call Idaho's Crisis and Suicide Hotline 24/7 by dialing 988.
Those things are already in place. We just need to do a better job of helping the community be aware of it.
Reporting in Pocatello, McLean Westbrook, KPVI, news that works for you.